Hello, my lovely. How are you? I'm Dr. Nicola. I'll be carrying out your full physical exam today. Nice to meet you. How have you been? Good. Please get yourself comfortable and just sit as you would normally. Okay. I'm just checking out your posture. Now, could you just sit up nice and tall for me? That's much better. Any discomfort anywhere? Okay, you can relax. Just look straight ahead for me. I'm just having a look at your face. Just seeing if everything looks symmetrical, my lovely, okay? Let's look at your eyes. Okay. Open your eyes nice and wide. Okay, relax. When did you last go to the opticians? And how was everything? Okay. When did you last go to the dentist? And how was it? Okay, good. Right, do you know how tall you are, my lovely? And what about your weight? How much do you weigh? Okay, thank you so much. So, do you know what the date is? And do you know where you are? And do you know why you're here? What's the time? Okay. And what's my name? And what's your name? And how old are you? And what's your date of birth? Fantastic. Are you feeling alright? Okay, just relax, okay, you're doing really well. So far everything looks good. Alright, wonderful. So, you look a little bit uptight, my lovely. Is it because you're here or are you just feeling a little bit stressed? Okay. Alright, we'll just try to relax, my love, okay? It's all good. Okay. I'm just having a look now at your skin colour, your texture. Seeing if anything stands out to me that's not quite normal. And your eyes. Quite, got a bit of dark circle, but it's quite pale. Are you always like that, or have you noticed it's a little bit more? Yeah. Alright. Alright. I will pull down and have a look in a bit. And it's a bit of a dark circle, that's okay. Yeah. All right. Okay, other than that, I think everything looks fine. If I could just have a look at your hands, please. Just put them out. And can you turn them over? Good. Okay. Fantastic. So, just briefly want to know if there's been any changes in your health recently. Okay. And have you been having trouble sleeping? Have you been sleeping too much? How's it been for you? Okay. And what about your mood? How's your mood been? Have you been alright? Okay. And what about your appetite? Yeah. Okay. Good. And what kind of things have you been drinking, my lovely? Okay, that's good. Okay, that's fine, don't worry. And have you been getting any exercise or at least some fresh air? Okay. Wonderful. Have you got any pain anywhere, discomfort, any parts of your body that's not quite feeling the same? Okay. Since when? Okay, so that's fine. So other than that, do you have any symptoms that you are concerned about, or any problems or anything that you've noticed? Okay, that's fine. If you do think of anything throughout, please just let me know. Wonderful. Okay, so I'm now going to check your temperature. So first, I'm going to pop it on your forehead. Okay. Okay, now I'm going to pop it in both of your ears and see what that says. Okay, in we go. Other side. That is 37, which is perfect. Okay, not concerned with your temperature. Have you been having any feelings like you have a fever or anything like that? Okay, that's perfect. Good. Now, I am going to get your index finger. I'm going to pop this on. Now, this is going to tell me your oxygen levels and your pulse rate. Okay, so if I can just have your finger. Okay, I'm just going to leave that there. If you just rest there for me, okay. Then I'm going to get this wrist. Okay, and I'm going to have a listen. Well, I say have a listen, have a feel. You know what I mean. I hope. Okay. Okay, it's a little bit on the fast side, my love. Oxygen levels are perfect at 92. All right. Okay, I'm going to take that off. So your pulse is strong and in perfect rhythm. Okay, it's just a little bit fast. But if you're a little bit nervous, or a little bit anxious about being here, that could be why. So I will check it again in a little while, if that's okay. Good. So I'm now going to listen to your chest, alright? So I'm going to be listening to your lungs and, of course, your heart. Okay? Alright. So I'd just like you to breathe normally unless I say otherwise, okay? Okay, would you mind if you can just pull your top down slightly? That's fine. Okay. Are you ready? Okay, here we go. Oh, it sounds nice and strong. Good rhythm. Perfect. Okay, if I could just have your wrist. Let me just see if I can feel your pulse again. Okay. 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 Take a nice deep breath in for me. Hold it. Out. In. Hold. And release. Good job. Take a nice deep breath in. Hold it there. And out. Good job. In. And out. Perfect. If I could just go around a little bit. Okay. Take a nice deep breath in. Hold. And release. Good job. Okay, write some notes a second. Okay. So, heart strong, lungs clear. Got good expansion. No crackling or any strange sounds, no rattling or anything. It sounds nice and smooth, clear in and out. It's very good. And your lungs are perfect. Your heart sounds really nice and strong. Great rhythm. Okay, pulse still a little bit fast, so I will keep an eye on that. Do you ever feel breathless, or like your heart's going too fast, or like heart palpitations? And what are you doing when that happens? Okay. Alright, I'll keep an eye on that for you, my love. Okay, good. Wonderful. I'm not going to do your blood pressure till a little bit later. Alright. So. Okay, so now I'm actually going to watch you breathe. Alright, and that probably sounds a little bit strange, but if you could just stay nice and still, nice and quiet, and just like so, and I'm just going to watch your breaths. Okay. Okay, can you take a nice deep breath in and hold it, my love? Okay, and if you can release that. And back to normal breathing. Okay, take a nice deep breath in. Hold it there. And release. And back to normal breathing. Okay, movement seems fine. Okay, so right, if I could just have your hand. Okay, I'll just pop it on mine. Okay, hand feels a little bit on the cool side. It always feel like that. Okay, and the next one, if I can have that one too. Okay, can have that. So hands are cool. And what about your feet? Do they feel cold quite often, or? Okay. If I can have a look at your hands again. Okay, looks fine. Just checking your circulation, my lovely. Now, do you find you get cold hands and cold feet quite often? Yeah. Okay. And that's been for some time. Right, okay. Okay, so that looks fine. I'm happy with that. That's fine. I'm happy with that too. That's good. Right, a bit more breathing. If you could just take some nice deep breaths, but not too deep. So, okay. Good. And now back to just normal breathing, nice and steady. Okay. And can you take a bit of a deep breath and release it? Another one and release it. Okay, I'm now just going to observe one more time. I'm going to just check how often we're taking breaths, okay? Just listening, okay? Just breathe. Okay, take a nice deep breath in. And release it slowly. Good. Take a nice, slow, steady breath in. And release it really quick. Okay. And now can you do slow breaths in and out in your own time? I'm just going to be listening and observing. Yes, like that, that's perfect. Okay, that's fine, keep going. Okay, now can you try to do some quick breaths in and out? And back to normal breathing. Right, what I'm going to do now, if it's okay with you, I'm going to touch different sections of your chest and I just want you to breathe, okay? So I'm just going to touch that first. Now just breathe normally. And outside. And centre. And higher up. Good. Okay, same again, but I want you to take nice deep breaths and out, okay? Yep. Good. I'm going to move position now. And here. Good, and here. Okay, relax. I'm happy with all that, my lovely. It's really good. You are breathing perfectly, okay? I can't see you struggling for breath. All sounds nice and smooth, and you know, there's no abnormal vibrations or anything abnormal. You are got a really good expansion in and out. It's perfect, okay? So I've got no problems with that. Have you been having any issues with breathing or anything like that? Okay, good. Okay, so I'm happy with your lungs. I'm happy with how your heart sounds, but just got to check obviously the blood pressure, and I need to go back to the pulse in a little bit. Okay, so I'll do that afterwards. Right, so okay, that's fine. Okay, I'm just going to get you to do a couple of things, okay? So, just sit nice and still. Can you just smile for me? Good. Show me your teeth and smile. Relax. I want you to raise your brows. Relax. Frown. Relax. Can you puff out your cheeks a little bit? Good. Can you suck them in? Can you pout? Perfect. That all looked perfectly fine. Okay, now if you could open your mouth, close it. Open, close. And can you make a chewing action? Any pain or discomfort? Okay. Okay, that's really good. I'll do a couple of those things in a moment. Right, if you wouldn't mind just standing for me. Can you stand nice and tall now? Any pain or discomfort anywhere? Okay, you can sit down. That's fine. Right. Pop on some gloves. There's a few things I want to do with my gloves and without my gloves, and it's just easier sometimes to keep them on. Okay, right, let's start with you holding my hands. Okay. I'm going to squeeze nice and tight. Okay, now release. Squeeze. Release. Squeeze. release. Now squeeze your left, release, and again, release. Your right, release, again, release. Okay, and both at the same time, and release. Good job. Right, go like that. Okay, I want you to push me. Okay, now I'm going to push you back. I want you to try and resist it, okay? Good job. All right, that's fine. Put my hands on you here. Shrug. And again. Now I'm going to push down and I want you to push me off, okay? Okay, well done. That's fine. So your grip feels nice and sturdy. Don't feel any problems there, and you're resisting me quite well, and you're doing everything I asked, so that was fine. Now if I just have a look at your hands properly. A little bit of dryness here. Look at your nails. Feel quite strong. Any pain here? About that? Okay. Feel okay? Okay, that's fine. How's that feel? Good. A little bit of tension in there. And a bit around the wrists as well. Okay, other one. Again, a little bit of dryness. Nails nice and strong. Any pain or discomfort here? Okay, a little bit there. And there, okay. Okay, which hand do you write with? Okay. Still? Yeah, okay. Okay, that's fine. Let's take this off for a little bit. Okay, right. Now, I would like to have a feel around your scalp, if that's okay, and feel around your face, your sinuses, and your glands. Is that all right? Okay, good. So let's have a feel. Tell me if you feel any pain or anything abnormal. Just going to go through your hair. Okay, that all feels fine. Okay, I'm going to just feel on the face. Feels fine, can't feel anything abnormal. Okay. Tell me if you feel any pain. Close your eyes. Any pain? Open. Okay, I'm going to pull down your eyes. And up. And just down. On the side. Okay, that looks good. Eyes are a tad bit red in places, but nothing too excessive. Your oil and tear ducts look fine, nice and lubricated. All right. Okay. Now, can you tell me if this feels the same? So that to that. That to that. That to that. That to that. And that. Okay. Now I'm going to do it at the same time and tell me if they are the same pressure. Okay? Okay, good job. It's fine. Right, I'm just going to go down here. A bit tender here, my love. Just open, close, open, close. Now can you chew? Okay. Glands feel fine now. I'm going to bring it down now. Yeah, that feels good. Okay, that feels fine. Okay. Sinuses feel good, no blockage. Glands feel nice and good as well. I can't feel any problems or any swelling there. Your face looks very symmetrical to me. I can't see any drooping or any swelling or any abnormalities. Everything looks perfectly fine. Alright, now if I could get you to put your chin right to your chest for me. And tell me if there's any pain anywhere when you do these movements. Okay, now back up. And can you put your head right the way back, but gently and steady? Wonderful. And slowly back up. Now if you can turn your head that way. A little bit further. Okay, and gently back. Same again that side. A little bit further. And gently back. Alright. Now can you rotate your head in a big circle for me? That's it. And the same again but the other way. Good. Well done. Feel okay? Okay, just shrug a little bit. And do one shoulder at a time. That's it, like that. Perfect. Good. Put your hands here and do this for me. And do it the other way. Now just listen out for any cracking, any popping, seeing if there's any restriction or anything like that. And if you do feel any pain or discomfort or any weird sensations, if you can, let me know. Good. Now what I'd like you to do is stretch your hands right the way out for me. Good. Okay. Now I want you to bring them right the way up. That's it, like that. Back down. Both out to the side. Back. Now just that side out. Relax. This side out. Relax. Okay, now this side up. Down. And that side. Down. Good. Perfect. Feel alright? I couldn't see any restriction, and I heard a little bit of cracking here and there around your shoulders when you were moving, and that. Do you find that you get a little bit of pain and discomfort in those areas anyway, or is it just with these movements? Okay. Alright. I will have a feel around there for you in a moment, okay, my lovely? Okay. Right, what I'm going to do now is just have a feel down your arms. Let me know if you feel anything. Okay, that's fine. Feel around your shoulders. Okay, just feel like here. And down and centre. Any pain there? And now I'm going to go into your tum. Now, how is your digestion? Are you alright? How often are you going to the toilet? Okay. And what about bladder? Okay, right, so I'm going to have a feel. Tell me if it hurts. Or any discomfort or anything. Okay, take a nice deep breath in and hold it. And out. Could you cough for me? And again. Okay. That feels okay, my lovely. I can't feel anything that shouldn't be there. Alright, now is it alright if I just feel down your legs and your hip? Feel around your foot. Okay, another one. Okay, that's fine. On the hips. Okay, that's fine. I'm just going to check your reflexes, okay? So if you just relax. Okay. Same again. Lovely. Relax your arms. Okay. Put your hand out. Can you feel this? And relax. Okay, other one. Feel that. Yeah. That. Good job. Good. That's perfectly fine. Okay. How are you feeling? Good. Okay, would you just swallow for me? Put your hand there, and again. Okay, and just cough. Okay. And can you sniff? Just for your nose. Okay, some tissue there. If you could just hold it in front of your nose and just blow out for me. Okay, perfect. Okay, and just make a... And... Can you hum? Can you say ah? Okay, good. Tilt your head for me, my love. Have a little look at the nose. Okay. Okay, that's good. Okay, open your mouth for me nice and wide. Say ah. Pop your tongue out for me. Curl it up. Can you wiggle it? Now what about the roof of your mouth? Into that cheek. And into the other cheek. And back. Say ah. I'm now going to pop in this. Press down. Try to lift me off. Okay, and relax. Say ah. Excellent. Your throat looks nice and clear, no swelling, no redness. I can't see any ulcers, any lesions or anything like that in your mouth. It looks perfectly fine and your tongue is moving as it should. And again, I can't see any abnormalities. But what I do need to do is just have a little feel around your tongue, just to be on the safe side. Alright, so if I can just have a feel. Okay. Roof your mouth. Sorry, I know it's a little bit tickly. This side of the cheek. Okay, that's fine. Okay. Right. Okay, wonderful. Mouth. Good as well. So just open for me again, my lovely. Open wide. Looks like you might grind your teeth or clench or something like that. Has the dentist ever mentioned that to you? Right, okay. You might be better off having maybe a night guard or something like that, just to protect your teeth. But just by having a look, your teeth look fine. Okay, nose. Hold one nostril and blow out. And now breathe in. And then do the same again, please. Okay, good. Sounds nice and clear. Okay, that's good. Can you wiggle your fingers for me? Good. Right, if you wouldn't mind just casually walking to that side of the room for me, okay? Okay. Now if you could come 1 foot in front of the other. Perfect. Okay, and stop there. Now could you stand on one leg for me? And can you try the other one? Okay, good job. And just come and sit back down. You're a little bit wibbly. Are you quite clumsy? Okay. Right. Okay, wonderful. So I'm going to have a listen to your tongue in a moment. What kind of things do you eat? Okay, what about to drink? Yeah. Okay, that's fine. And how often did you say you go to the toilet, my love? Okay. Okay, that's fine. Any concerns with anything down there? Okay, that's fine then. So I'll have a listen to that in a moment. Okay, if you could lift up your top slightly. Okay, that's it. Wonderful. Okay. Just breathe normal. Just take a nice deep breath in and hold it a second. And release. Your belly, a little bit rumbly, a little bit gargly, but nothing too excessive. Okay. 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 Right, I'm just going to have a feel around your ears. Feels fine. That feels fine. Okay, I'm going to have a look in your ears in a little bit, okay? Now, look straight ahead, close your eyes. I want you to tell me which side you can hear this sound, okay? Okay, and now this sound. Fantastic. Now that sound. Excellent. Look at me. Alright, so what I'm going to do now is make that sound. I'm going to start by your ears and work my way out. Tell me when you can't hear it anymore. Alright, my lovely. Okay, close your eyes. And tell me when you can hear it again. And same again the other side. And tell me when you can hear it. Okay, lovely. Now, do these sound exactly the same? Or is one side louder than the other? What about now? Now. Okay, that's fine. Keep your eyes closed. I'm just going to say some words and I just want you to repeat them. Okay. Coconut, coconut, gingerbread, gingerbread, cinnamon, cinnamon, popcorn, popcorn, chocolate, chocolate, and cheese, cheese, pineapple, pineapple, cucumber, cucumber, flowers, flowers, raspberry, raspberry, bubblegum, bubblegum, tick-tock, tick-tock, stipple, stipple. And you can open your eyes. Your hearing seems perfectly fine, my lovely. No problems there. Good. Okay. Now, look at me. How many of me can you see? Good. Look at my nose. Finger. Nose. Finger. Your nose. Finger. Okay, so what I want you to do, just with your eyes, look at my finger and then my nose. Okay, good. Ready? Finger, nose, finger, nose. That's it, just with your eyes. Finger, nose, finger, nose, finger, nose, finger, nose, finger, nose, finger, nose, finger, nose. Excellent. Now, just with your eyes, if you could look here, here, good job. Cover that eye for me. Look here. As expected. Okay, and cover that eye. Look here. As expected. Okay, you can uncover your eyes. Good job. Straight ahead. for your eyes. Look here. 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 Good job. Same again. Look here. Wonderful. Look at my nose. Keep looking at my nose. Tell me when you see a side move. Okay. So keep looking at my nose. And again. Again. One more time. Actually, I'm going to do further away again. Okay, wonderful. Here, I'm going to put a different amount of fingers up, if you can tell me how many. Okay. Keep looking at my nose, that's it. Okay, good job. Okay, keep looking straight ahead, that's it. Good job. You can see everything clearly. Wonderful. Straight ahead. Okay, look at my nose. Tell me when you can see my fingers. Okay, tell me when you can't see them. Keep looking straight at my nose. Good job. Okay. Perfect. Okay, I'm going to have a little look in your eyes. All right, with this light. Okay. Straight at my nose. Okay, let your eyes adjust. Look straight at my nose. Look straight at my nose. Good job. Excellent. Now a little close up, then I'm going to look in your ears. Okay. Okay. Look up. And to your left. And to your right. And back at me. Okay. Eyes look nice and clear and nice and healthy. I'm now going to have a look in your ears. I'm going to pop in my otoscope. Alright. Smooth your hair. And in we go. That looks good. I can't see any redness, swelling. Let's go a bit deeper. A tiny bit of wax, but nothing too excessive. Okay, it's not too bad. Okay, the other side. And in we go. No redness or swelling or compaction. Let's go a bit deeper. Yeah, there's not really any wax. It all looks nice and healthy. It's really good. Okay. Both ears look perfectly fine, my lovely, okay? I'm happy with that. Okay, my lovely. So, okay. I'm going to finish off by checking your blood pressure and your pulse. Okay. Okay, we'll take from this side. Okay, like so. Okay. That's it. Wonderful. There we go. This will go very tight, okay? Okay, just relax your arm for me. Okay, relax. Okay, that's fine. that's all good. Let me just check your pulse. That is wonderful. That's perfectly fine. Right. Right, I just want to feel your neck, okay? Bit of tension here, bit of build up. I would definitely recommend having a massage, my lovely. Your spine a little bit. Okay. Alright. Keep an eye on that. See how you get on. If you know, it really starts to get bothersome, please come back and I can refer you on to somebody, okay? But I'd recommend maybe having a sports massage or something like that, see if that helps. So there we go, that is your full physical exam complete. You did absolutely amazing. I'm very happy with everything. I've got no concerns at all. Alright, you're very welcome. I will see you again in another year. Alright, it's lovely to meet you. You take care now. Bye bye.